really are more likely to die in hospitals at certain times of year or to suffer a medical error. Researchers looked at hundreds of thousands of patient deaths at teaching hospitals and found the link to the annual influx of new medical residents. And here's Deborah Roberts.
The new study makes a startling finding. The most dangerous month to walk through those hospital doors, it seems, is July. What is it about July?
I think that there is the turnover of staff, and that's a time when people are just learning, and mistakes can be made during that time.
It's been called the July effect, the time when hospitals take on new medical residents with very little hands-on experience.
You will be pushed to the breaking point.
TV hospital dramas like Grey's Anatomy drive home the huge learning curve for young doctors. Are new physicians possibly putting patients at risk? They may be, according to researchers who looked at 26 years' worth of hospital death certificates for 62 million patients. Here's what they found. In teaching hospitals where interns are more likely to be assigned, patients were more likely to die from errors in their medication in the month of July. Just a simple mistake, for instance, moving a decimal point on a prescription one notch from 2.5 milligrams to 25 could be fatal.
Are you having chest pain right now?
But it's not just the month of July. There are other things to be concerned about when you're a vulnerable patient. Beware of shift change, a time when critical information may not be passed on to the next person taking care of you.
Periods of change are risky. So nursing shift change, weekend change, those are periods you have to really watch out.
But the bottom line, some simple advice.
I think it's important to have an advocate, someone who's there with the patient, who's looking out for their best interests.
And exactly what kinds of things should the advocate do?
Well, Diane, they should take notes. They should pay particular attention to medication, for instance, because doctors sometimes may give something and you may not be quite clear about it, or you may have an allergy. But most important, don't be intimidated. Doctors pay closer attention when you ask questions.
That's right. Just keep asking and asking every person who comes in the room. And if you want to know the three things, the most important things you should put on a piece of paper and hand out your next hospital stay, go to our website, abcnews.com. We have them there.